All right, so as many of you know, I had a type 2 tibial plateau fracture, but after 5.5 weeks, I was dancing salsa again with doctor's permission. So these new videos are gonna show you exactly what I did, how I did it, and make sure to reach out, link in the bio if you want some personal help with exactly how you can do the same. All right, so exercise one is very simple. First, you just wanna sit and see what you can do with your knee. So my broken knee was my left knee. And so what I was doing, and I'll post some pictures, I believe here where we can see it, is I just started to slowly try to move my knee, not necessarily in this linear fashion, but trying to get a little bit of a bend in it. So from this direction, because what you're going to start to notice is it's going to really, feel completely different than your healthy knee. Because the goal of what we want to do is to slowly slide it in like this. And I have not shown the picture yet. You'll see it now, where I was able, I think in 1 month, to sit cross-legged. Now, when I started doing it, again, my left leg was my broken leg. I started, even in this picture that you saw there, completely up like this. And then what will happen is you can also massage it as you're doing it. It's going to be painful, but you want to start to slowly get it to drop down, because we need to start stretching the, believe it or not, ligaments. We need to get the screws in the bones to start to move a little bit, because bone is the most sensitive tissue in the body. And one of the analogies I often use is, imagine like a table, so like your desk. And if you were to break the corner of your desk off and then you need to put it back on, well, you could have a few options. You could glue it back on, or you could, let's say in this case, bolt it back on. Well, if you bolted the corner of your desk back on, right? So it broke off, you put it back on, think of like an IKEA desk, and you screwed it in there. Well, if that corner is gonna, before it breaks off again, that corner of the desk is gonna get loose, right? Because the screws inside are gonna start to wiggle a little bit, and that corner is not just gonna fall on the floor, it's gonna start to get loose, move, and then eventually fall. That's a good analogy for your knee, because bone is the most sensitive tissue in the body. And if you have plates and screws in your knee, which most likely with this injury you do, then you have to realize that the screws are in your bone. So if you start doing things that are too much for your knee, and the screws start to move around too much, which is not going to happen, but if it did, bone is the most sensitive tissue in the body. I've said that a few times already. So it will start to be so painful, it's insane. Now, when I first started, I was like this, and then I massaged it, and slowly it went down and down and down, and it got better. If it starts getting better, you're not killing yourself, because if it was horrible for you, your body would not be able to, it would continue to hurt. It wouldn't get better. So you need to start learning how to listen to your body. So the goal is to become, or to be able to sit cross-legged. You can do it however you want, but also when you get to that position, try to also switch the legs. Now again, my knee is fine now, it's been a few years, but like I said, I'm posting pictures throughout this video where you can see where I was, and I'll even put the dates across my journey from when it was broken to when the picture was taken, and you can see that this is the direction that I went. So here is exercise number one. All right, now exercise number two is trying to get in this position. Now you're gonna be nowhere near this Japanese sitting position yet. Don't worry about that. So I have this chair here. So what you can do, and I'm trying not to get out of the camera here, you sit just like this. So my goal is obviously to come down, but it's gonna be too painful. And if it's too painful for your knee, so mine was the left knee, but let's just talk about the right at this moment, then you can put something under it so it's padded. But the goal here is to slowly start going down. So you can either come down this way, or if it's more comfortable, you can bring your knees in like this, because that's gonna slowly start to lower it also. It's going to be painful. That's okay. Don't push too much through the pain, but you can also start to just rock back and forth. These very, very, very basic exercises are gonna help. Like I said in the previous exercise, the first exercise, is it's gonna start moving those screws a little bit in your bone, which is good because your bone needs to adapt to them, but it's also gonna start signaling to your nervous system that you want it to start healing, which is also important, but it's going to also start to break up some of that scar tissue, which is extremely important, because that is what has that chemical inside of it that's making everything even more sensitive. So if something's more sensitive, then it's going to be more painful. So by doing something just like this, or trying to go as low as you can and hold it, will start to help dramatically, because then your rehab is going to be much better and much faster. I was told, again, not to basically walk for the first 6 to 8 weeks. I got my x-ray after 5, and as you saw maybe in my first video, I was literally dancing salsa before week 6 because my bone had already healed, and I'm convinced it was because I was doing these small things throughout the first 5 or 6 weeks. All right, so the last one is this simple stretch. Sorry for the camera angle, I'm not completely in, but you can see the important leg. Now, when I had my break, I actually just used my crutches to stand like this. I don't have my crutches here anymore. So what I have now is just actually my treatment table, a bit in the picture, because you want to be able to, you want something to help with your balance, especially when you have a broken leg. So if this 90 degrees is too high, this would be my injured leg I have right here. If this is too high, you can find something lower. But what is really nice is when my leg was broken, what I would do is I would either lean on my crutches or lean on something, kind of do this with my leg, get it up, and then go into the flexion like this. I believe I have some pictures somewhere, hopefully. If whatever I have, I'm gonna put up in these videos, because I have an entire story on my Instagram about part 1 and part 2 of my surgery, where I documented everything. So here, this is a fantastic way just to slowly start getting that flexion back within your knee. You saw in exercise 2, we did something similar. In exercise number 1, we were working more on the knee rotation. The knee is not supposed to rotate very much, but it should rotate a bit. And breaking up all of the scar tissue is crucially important. So this is a fantastic way to just start getting some of that motion back in your quadricep, the flexibility, and also some of that bend in your knee. So hopefully those videos were very helpful. Please check my Instagram out at American PT Stuttgart, because there I have 2 highlight reels of part 1 of my surgery and also part 2 that are extremely beneficial. You can also reach out to me there, give me a message, and I'm more than happy to help. If you look at the link in the bio, you can also book an online appointment with me. I have many clients that come to my office, but I also have clients worldwide. I run it the same way. Whatever my price is for the hour to come into my office, you can do a Zoom call and get the same thing, and I am more than happy to help you wherever you are in your rehab. I'm creating a program right now. I'm going to build it out for all knee injuries. I don't have it done yet, so in the meantime, book a call, call me, let's work together, and I can draw something detailed out for you or give you better insight with how you can move forward with your knee injury.